Bloomberg Audio Studios.
Podcasts, radio, news.
You're here today because the CDC has issued sweeping new guidance around COVID isolation and other respiratory viruses. Tell us about today's changes.
Well, first, we want folks to know that we're in a new place, and that's fantastic. We're seeing less deaths, less hospitalizations from COVID, but we want to make sure folks are using the tools we know work. That's why we've released these updated guidance, not just for COVID, but across respiratory virus like COVID, flu, RSV. And most importantly in those recommendations is get vaccinated.
And the recommendations suggest that if you are 24 hours fever-free without medication and you see your symptoms abating, you can return to life, to school, to work. Why now? What has changed? We haven't seen new guidance in a few years.
Right. So we are in a new place. So we were able to put out this updated guidance, again, because we're seeing less hospitalizations and less deaths from COVID. As we were still seeing high levels of viral spread. We have wastewater data that shows that there was a lot of COVID that was circulating this winter. But the good news is we weren't seeing any increases in those hospitalizations or deaths. And so with that continued trend over yet another season, we felt we could move forward. The other is we were also seeing that the folks who came to the hospital with COVID this season, 95% of them did not get an updated COVID vaccine. It made us want to reiterate how important getting vaccinated is to keep you out of the hospital.
Vaccine uptake in the United States continues to decline with each booster shot. So how are you considering the latest uptake numbers as you issue this guidance?
You know, we saw few folks get the updated COVID vaccine this past season. Now, it was slightly higher than the year prior, which is good, and we're hoping to build on those trends, but not as high as what we're seeing with flu shots. And we want folks to anticipate they're going to be an updated COVID vaccine as well as an updated flu shot later this fall. So get ready now for your updated COVID vaccine and your flu shot coming this fall.
Dr. Cohen, how do you respond to Americans, particularly those over the age of 65 or the immunocompromised, who may feel that this guidance leaves them more vulnerable to infection?
Well, I want folks to know who are at higher risk of bad outcomes from these viruses to know they were top of mind when we were putting together this guidance. We all know someone who is over 65 or immunocompromised. They're in my own family. And so I was thinking about them when we did this guidance. We wanted guidance that was simple and easy for folks to understand. More people are able to follow guidance that is simplified. And if more people are following that guidance, that means less viral spread and more protection for us all. In addition, we do have tools that can protect those that are most vulnerable. Vaccine, again, is the most important tool that we need to be using, making sure that folks are staying up to date with their vaccines. And then we released additional guidance for those who are over 65, for those who are immunocompromised, our disability community, pregnant moms, and younger kids. They're all special considerations that we want to make sure they're following as well, so we can keep those who are most vulnerable protected.
Throughout the pandemic, the CDC faced some criticism for mixed messaging around guidance. I wonder, is this effort to streamline for COVID, flu, and RSV an attempt to address those criticisms?
We've learned a lot of lessons through COVID. One of them is to have simple, clear communication. I think that's what you're seeing here. We're trying to help folks really prioritize what are the most important actions to take, and so that they can remember what to do no matter what they have. The reality is we know a lot of folks aren't getting tested when they get sick, and so we want them to have easy to follow guidance no matter what they have. Top line, though, continues to be get vaccinated.